Good evening, everyone. This is Dr. Moreau with Mrs. Moreau for Cause L'école. Today we are here with you to talk about PTSD. And as you know, June is PTSD month awareness. So we want to share information with you regarding PTSD, what it is, the effects, how do you know you have PTSD, and what can you do about it? What are the solutions that can help you with PTSD? So I'm gonna let my wife Michelle Moreau go over the PTSD with you, and we hope that you'll pay attention and share this video with your friends. As you know, mental health is crucial to our well-being, and mental health is also healthcare. So,
Hi, hello everyone. Again, welcome to Cause L'école tonight. We spent some time with you guys last month as we focused on mental health, which was Mental Health Awareness Month. This month is more focused on PTSD, post-traumatic stress disorder. Again, we want to bring the focus back to reminding you, check on your family members, call them, check on them. If you notice something is wrong, something has changed out of the ordinary, they're not themselves, and it's time for you to do something. Don't remain silent. Again, stay in touch with them so at least you will know when the change happens. So when the person is sick and end up hurting themselves or someone else, then you know at least you had a chance to try to prevent. A lot of these things can be prevented. PTSD, as we said, is post-traumatic stress disorder as a result of a stressor or trauma that can occur in your life, whether you witnessed it or whether the trauma was directly impacted yourself. And we have PTSD. Whenever you hear PTSD, everybody always goes straight to military. PTSD is not just simply military related. PTSD can be because of a personal violence, could be abusive relationship, domestic violence, physical violence. It could be a robbery, it could be rape, kidnapping, a hostage situation, terrorist attack, torture, I mean, you name it. Natural disasters, hurricanes, fires, a loss of a job, loss of a loved one. It could even be a car accident, a traumatic car accident. Every time you pass by that place where you had that accident, you reminded of it, or you try to avoid that area. So there's a lot that can cause PTSD. I want to differentiate with you PTSD and acute stress disorder, right? You may have an event in your life that happens. Let's say you lost your job. That's a stressor. It causes you stress, but that stress does not last more than a month. So if the stress resolves within a month, then it's acute stress disorder. Anything beyond a month, prolonging into 6 months after, that's when we target and we look for symptoms of PTSD. So you can have acute stress disorder, you can have PTSD. Acute stress disorder resolves within a month, and then PTSD prolonged thereafter. Risk factors that we can say about PTSD, again, it's an experienced event, whether it happened directly to you or whether you witnessed the event. There are some studies out there that relates some genetic disposition, where it can run in the family. If you have a family who has major depression that runs in the family, you tend to have PTSD as a co-diagnosis. So we have different symptoms for PTSD. PTSD causes hyperarousal. It causes insomnia. It causes insomnia, we know it's lack of sleep. Hyperarousal means that anything startles you, anything makes you scared, anything that relates to that event has you in a frenzy. You have tachycardia, where your heart races very fast, diaphoretic, you start sweating, you can't breathe, you just go into a panic whenever you either think of the situation or you are placed in an area where that incident happened. Flashbacks, nightmares, and intrusive thoughts where you keep thinking of that episode, of that rape, of that violent episode, of that accident, of the loss of the loved one, of the fire, whatever caused that stress. You keep thinking about it over and over and over and over. So that causes you lack of sleep, and that causes you to have nightmares. There are different treatments out there for PTSD. Again, it doesn't have to be military related. We know a bulk of it is military. Anybody who's been in the military most likely will tell you that they've had some sort of PTSD, either because of things that they've witnessed, things that they've been involved in, and things like that. But now that we are informed that PTSD is not just related, military related, it could be anything else. As far as medications or treatments for PTSD, it could be psychotherapy. One of the main psychotherapy that is used for treatment of PTSD is called EMDR, which is eye movement desensitization and response. So it's a technique that is used to help you to change the way you think of that event. So you go to the therapy session, they have you close your eyes, you have rapidly moving your eyes in the moment where you are thinking of that situation and how it makes you feel. Then the therapist helps you to associate a positive experience with that event instead of a negative. So then you sort of desensitize yourself from that negative event and how it affected you. Pharmacotherapy, as far as medication wise, you could use one of the main leading one that we use now is called prazosin or mini press, and that's the one that is very effective for nightmares with PTSD. So you can have TCAs, which are your tricyclics. You can use SSRIs, your selective serotonin inhibitors. So there are other medications that your doctor can find that could work for you. But the main thing is to couple psychotherapy with pharmacotherapy. So while you're taking the medication, you're doing some sort of therapy as well to help you change the behavior or help you change your way of thinking. Again, we have these sessions, so it could be helpful to you guys. Any little information that we can provide to you is very helpful. Again, remember that we are here for you. We have the Center Family Empowerment Mental Health Center, which is located in Miami Gardens area. And if you guys are suffering, any of you suffering, a family member, a friend, refer somebody, come get therapy, come get treatment. Don't suffer in silence, because mental health is ravaging our community, our society, and people tend to hide it. The stigma of not going for help, because people would think that you're crazy. They will label you, or they will treat you differently because you have a mental health condition. But then they don't treat you differently when you have diabetes. They don't treat you differently when you have high blood pressure. So that stigma of mental health tend to push people away and they don't go seek help. So we are encouraging you to seek help. Send somebody, refer somebody, and so you can have a healthy mental health.
I have a question. What exactly do you think happened to someone who refused to seek help, to seek mental health therapeutic services? The person knows that they've been to an accident. They know they have post-traumatic stress disorder. They know that they have that disorder, but they don't seek help. So how do you think that can impact someone, whether it's at home, at school, or how do you think?
Well, what happens with that person, of course, anything that is left untreated, logically, is worsened, right? You could have high blood pressure and you don't treat it, then it gets worse and it causes something else. Then it causes your heart to malfunction. It causes a bunch of other things that you could have prevented. Same thing with mental health disorder. You have an event in your life that happened. You see a month later, 2 months later, you can't seem to get over it. It's running in your mind. It's ruminating in your mind. It's coming into your brain, and it's crippling you because then it's getting worse and worse. 6 months later, you can't function. You can't go to work. It affects your job. If you are a school student, all of a sudden your grades are suffering. You can't concentrate. You can't pass your tests or your quizzes because you're sitting in class. All you're thinking about is that particular event. Like I said, it could be an event that happened to you personally, or it could be an event that you witnessed. So it doesn't necessarily mean that you are the victim. You could have been a witness to something, and it causes you that extra stress that you can't shake. So again, you don't go for treatment. You don't seek help. It gets worse. It affects your personal life. It affects your performance at work. It affects your performance at school, and your interrelationship is the same thing. Then all of a sudden you can't trust anybody. You have trust issues, and that just.
And how long basically is treatment? So if somebody say, okay, I realize I do have PTSD, I've been suffering, I haven't seek help, but now I realize I do need help because I can't function in life. I want to function better. How long typically is a mental health treatment for somebody with PTSD?
Well, it all depends. Labeling and putting a time frame, usually between 6 to 12 months. Within 6 months, you should be seeing some sort of resolution when you couple psychotherapy with pharmacotherapy, right? When you are taking the pills and you are doing your regular therapy session. So within 6 months, you should be able to see some results. Within 12 months, you could be discharged from therapy. But again, it all depends on how you're progressing. It all depends on your mental health. It all depends on how bad it was. It all depends on how quickly you seek help. The longer you wait, the longer it will take for you to recover, because then it's more work for your psyche to reverse the effect of the disease. So the sooner you get help, the better.
And as you said, you could do pharmacology therapy, or you could do psychotherapy, but that doesn't mean that those are the only treatment that's out there for everybody. Because as you just mentioned, the PTSD could be at a different level in someone than the other, because we're not all made the same. So somebody could be more affected, more impacted than somebody else. So somebody could see someone for 6 to 12 months, or it could be 18 months, 24 months, based on the level of how they were impacted by that event that caused that stress in their lives. So we are encouraging everyone who's watching to, if you know someone suffering, encourage them to seek help. because mental health is also health care. If you have a stomach ache, a headache, if you're suffering from all these other medical issues, you go to a medical doctor for assistance. It's the same thing with your mental health. So if you are suffering mentally, we are suggesting for you to seek help from a mental health professional. It needs to be a mental health professional, because if it's not, then the treatment you are looking for could be worse. So you do need to seek help from a mental health care professional. What else would you like to add so we can conclude the presentation?
Well, I mean, I hope that you guys got something out of the session. Maybe just the symptoms, maybe some way for you to seek treatment, maybe an encouragement, maybe you encouraging somebody else that you know who's suffering from PTSD to seek treatment. And you can see it, you know, the person they're suffering from PTSD, you brush by them, they're like, you know, their defenses are on alert, they're ready to attack, they're ready to defend themselves, because that's how the mind, that's how the psyche is affecting them. So you can tell, you can see it. Or I had an example of someone who was suffering from PTSD, who cannot sit with their back faces a closed door. Like they have to sit face an open door, because they think when the door is closed, whatever event that happened to them behind closed door is going to happen again. So the door has to remain open. You have other people. I remember when my son was in school, in elementary school, he associated the fire alarm with having an actual fire. And whenever there's a fire drill, he actually has, you know, that panic attack that there's a fire, and he couldn't perform. So of course he's outgrown it. You know, now he's a teenager. He's fine. But those were the events where he would, you know, sit in class and he would cry until the teacher tried to console him, because he actually thought there's a fire and everybody's going to burn. So those things, they do occur. They're there. They're real. Find somebody. Come get help. Family Empowerment Mental Health Center in Miami Gardens. Number is 305-952-3981.
3981. 305-952-3981. Call us anytime, 24 hours a day. If we don't pick up, leave a voicemail and we'll return the call as soon as possible. Or if it's an emergency, always call 911. Dial 911, because if it's an emergency, we don't want you to wait until 2-3 days to seek help. So call 911 so you can get immediate